Welcome, and thank you for attending this important discussion about the COVID-19 vaccines. I'm Milton Jones, UFCW Executive Vice President and National Bargaining Director. As I'm sure many of you know, UFCW represents 1.3 million frontline food and retail workers across all 50 states, Puerto Rico, and Canada. And I'd like to welcome the UFCW members watching today. The UFCW represents essential workers in grocery stores, meatpacking plants, and so many other frontline businesses that have been critical to keeping our community strong. Getting the COVID-19 vaccine is essential to keeping all of our UFCW members safe on the front lines. This will help us take control of the pandemic and protect both our families and the many communities we serve. We know that our UFCW members have questions about COVID, and today's town hall will help answer some of your questions. This past year, you have bravely stepped up when our communities needed you most, helping to keep our country's food supply chain secure and ensuring all of our families are able to put food on the table during this crisis. From processing meat in dangerous conditions to keeping our grocery stores open, America needed you, and you bravely answered the call. Many of our courageous UFCW sisters and brothers were directly impacted by COVID, with over 90,000 members getting infected or exposed, and 457 members tragically dying from the virus. The COVID vaccines are offering us hope and protection when we need them most. And that's why we're here today. All adults over the age of 16 are now eligible to receive the COVID vaccine, with 3 safe and effective vaccines now authorized for use. This is a critical moment and a time when we need transparency and understanding, making sure that all UFCW members have the facts about how these vaccines were developed. You deserve to know that these vaccines are safe, effective, and will be accessible to all of the essential workers in our union family. Each and every one of us will need to make our own individual decisions regarding vaccination based on the best information available. We all know how important it is right now to stay informed and help answer your questions about the vaccine. Today's UFCW virtual town hall event is an opportunity for you to hear directly from top health experts on the COVID-19 vaccine. Joining us today is Dr. Peter Marks. Dr. Marks is from the Food and Drug Administration, or FDA, where he is director of the Center for Biologics Evaluation and Research. As I'm sure you know, the FDA is the agency responsible for regulating and reviewing the safety and efficacy of the COVID-19 vaccines before they are approved. Also with us is Dr. Jose Montero. Dr. Montero joins us from the Center for Disease Control, where he is the director of the Center for State, Tribal, Local, and Territorial Support. Dr. Montero oversees support to health departments across the country, including those serving tribal nations and insular areas. And finally, Dr. Robert Harrison. Dr. Harrison is a clinical professor of medicine at the University of California, San Francisco, and is an occupational and environmental medicine specialist. Dr. Harrison specializes in preventing coronavirus spread in the workplace. So to get things started, I'll give each of our speakers the opportunity to say a few words, and then we will answer some of the questions you've submitted. First, I'm pleased to introduce Dr. Peter Marks, who will explain how each COVID vaccine was approved through the clinical trial process, and will also talk about the safety and efficacy of the COVID vaccines. Welcome, Dr. Marks.
Thanks so much for having me today. So the COVID-19 vaccines that we have now are 3 that are now authorized in the United States, and they have all come through a rigorous development process that has led us to conclude that they are safe and effective for use in preventing COVID-19. And it's important for people to realize that the way we got here in a year was not by cutting corners, but it was by going through a rigorous development process in which a lot of the usual extra time that's used between portions of clinical trials was removed. And so the clinical trials were done like they would have been in many ways for a normal development program, while at the same time, manufacturing at risk was ongoing, so that instead of taking the normal couple of years to get there, we were able to see these vaccines get there in about a little less than a year's time. And that's without cutting corners. The only place that one could argue we had to cut a little bit off of the timing was on the duration of safety follow-up, because normally we like to have about 6 months of safety follow-up. In this case, when we deployed these, there were only about 2 months on average for people, but we had a very robust safety surveillance system. And now we're getting to have watching cohorts of people that have been followed for 6 or more months. So I think people can rest assured that these vaccines were well studied. The most side effects, by the way, with vaccines manifest themselves within the first 2 months. So we feel comfortable that when we put these out there, that people can feel confident that they're getting something that's safe and effective. I'll say a few words about the 3 different vaccines. We have Pfizer, BioNTech, and Moderna. Each of those is an mRNA vaccine. mRNA vaccines are using a technology in which a type of messenger that's in the body that normally takes the information for our genetic material and makes it into protein is being used to help make that protein very briefly so that our bodies make an immune response to it. That little piece of mRNA is only present in the body for a short period of time, a day or most a few days, and then it's just destroyed. And the protein that's made is what drives the formation of the immune response. So those are the Pfizer and Moderna. The Janssen vaccine uses a virus that doesn't cause disease, and it essentially leads to a protein being made briefly that does the exact same thing. And those are the 3 vaccines that we currently have under emergency use. There are a couple of other vaccines that are in development. One of them just happens to be the protein itself, but those we'll hear about more in the coming months. Right now, the important thing is to understand that all 3 of these vaccines were highly effective in preventing people from dying from COVID-19 or getting hospitalized with COVID-19. There are some slight differences, modest differences in the prevention of milder forms of COVID-19, in which the Moderna and Pfizer vaccines were a bit better than that, than the Janssen vaccine. But the most important thing right now is that the people understand that all 3 of them prevent the worst outcomes. There's also a little difference in that the Pfizer and Moderna vaccines are 2-dose vaccines. One has to go back twice, either after 3 weeks or after 4 weeks, 3 weeks for Pfizer, 4 weeks for Moderna. The Janssen or Johnson & Johnson vaccine is a one-time vaccine, one and done. So there are various things to balance there, and people need to think about those. In terms of side effects, there are short-term side effects to all of these vaccines that occur in some people, and they're generally mild and only last for at most a day or 2. Those most common ones are local pain at the site of the injection, or feeling tired. That's the most common thing, feeling tired. Some people feel a little bit like they have the flu, and particularly that tends to be the case after the 2nd dose of the Moderna or the Pfizer vaccine. So I generally recommend to people after that second dose, particularly 12 to 24 hours after one decides to take it easy, because a lot of people just feel kind of like just sitting down in the chair and watching TV or taking a nap. So that's that piece. And again, it's not everyone, but roughly half the people or a little more who get them feel somewhat tired, at least after that second dose for the mRNA vaccines. In terms of more serious side effects, we've been very lucky. There are very few. You've probably heard about the Janssen vaccine being associated very rarely with a rare type of blood clot in the setting of low blood platelets. That was seen primarily in women between ages 18 and 50. It was still very rare, about 7 per million. And the benefits and risks of the vaccine still greatly outweigh, the benefits still clearly greatly outweigh the risks. But that's an area where if somebody has concerns, they should speak with their provider about whether that vaccine is for them, particularly if one is a woman of reproductive age. And, you know, aside from that, the allergic reactions with the Pfizer and Moderna vaccines have been relatively uncommon, and they're being very well controlled, about 1 in 250,000. Now that we understand them, they're well controlled, and we'll continue for all of these vaccines to watch very closely and make sure that if there are any emerging safety concerns, we'll make sure the public knows about them. And I'll stop there. I went on a little long. Sorry about that.
It's quite all right. Thank you, Dr. Marks. Next, I am happy to introduce Dr. Jose Montero, who will share an overview of the process taking place to distribute COVID-19 vaccines and how the CDC is working with providers and partners to communicate information about the vaccine. Dr. Montero.
Thank you very much. Good afternoon, everybody. It is a pleasure and honor to be here. Following Dr. Marks, I am going to highlight a few of the things that he just said to jump from there, what I want to talk a little more in depth about. So it has been 15 months since COVID-19 infections were first identified in the US, and we have 3 vaccines that were put to trials and that have been approved, all of this with the support of the US government. The Pfizer vaccine is currently authorized for people 16 and older. Moderna and Johnson & Johnson are authorized for people 18 and older. And Dr. Marks highlighted that all of these clinical trials were really good, quite a lot of people on them, which makes them really good to identify those issues that you want to find early on a vaccine. And they have proven effective and to prevent serious illness, hospitalization, and death. So for us, as a public health system, as a nation, the vaccine is this critical tool that will bring this unprecedented pandemic to an end. And we're making really good progress toward that goal. In our website at the CDC COVID track data, you can see every single day we are incredibly transparent with all of our information. As of this morning, May 10th, we have administered nearly 260 million doses. That means that with those vaccines, we have fully vaccinated 1 of every 3 people in the US. When we look at this by adults, which is the population that these vaccines is mostly authorized for so far, we can say that we have immunized completely 44% of the US adult population. For a disease that we didn't know 15 months ago to this incredible success, this is unprecedented, this is incredible progress. But we are not there yet. Even though we are vaccinating more than 1 million people a day, we continue to expand vaccine availability, and we hope that we can expand that fairly soon to adolescents. How does this authorization process work? So this week, the Advisory Committee on Immunizations Practice, ACIP, is an independent federal advisory committee of medical and public health experts. They are holding an emergency meeting. They are going to discuss and vote on expanding the use of Pfizer vaccine to adolescents between the ages of 12 and 15. This discussion and this vote are open to the public. You or your representatives can watch it online life. Transparency and communication are an integral part for us, and we build trust in the communities through that. You saw that when the J&J vaccine issues came up, we had these meetings open to the public, the discussions were open, the votes were open and public. Exactly the same is going to happen now that we're going to be, the committee is going to be considering the expansion of the vaccine to the 12 to 15 years old. And we do that quite in the open and discuss all of our data because vaccine safety is a top priority. And COVID-19 vaccines are being held to the same safety standards as all vaccines. Systems are in place to continue to monitor them, to really get a good sense of the safety of those vaccines. And we carefully review all reports of vaccine side effects. We have a team of scientists of different disciplines and doctors who look at that daily. Now, we know that the vaccines are good, that are effective at protecting you from getting sick. Those of us who are fully vaccinated, if you are fully vaccinated, your family members, if they are vaccinated, can start doing many things that you had stopped doing because of the pandemic. Now, outdoor visits and activities we know are safer than indoor activities. Fully vaccinated people can certainly participate in some indoor events without much risk, but in indoor public spaces, the vaccination status of other people or whether they're at an increased risk for severe COVID-19 or not is likely unknown. Therefore, fully vaccinated people should continue to wear a mask that fits quite well around the sides of your face, doesn't have any gaps, that have this bridge that you put over your nose, that covers cough and sneezes, and wash your hands often and follow any other applicable workplace recommendation or school guidance. Please remember what I just said. We don't know the others risk factors or the risk for severe COVID-19. We don't know if for whatever reason they cannot get vaccinated. So even though we are protecting ourselves when we get vaccinated, in these closed indoor spaces, we need to go a little above and beyond to help protect those others that are around us. So millions of people in the US have received the vaccine, and we are monitoring the system, and we can say that it's safe. All of these vaccines are carefully evaluated. Getting vaccinated can help protect you and others around you, especially, again, those at increased risk for severe illness. If you haven't been vaccinated, we encourage you to find a vaccine. In our website, the CDC website, cdc.gov, we list all of the different ways that you can find vaccines. You can put in your search engine, vaccine sites close to me, and you are going to identify there a big list of sites. And every state, they vary by state and by city, but you're going to find many of the chain pharmacies in the US. We have national contracts that allows those pharmacies to get the vaccine, and you can identify them, what hours they work, what type of vaccine they are using. You have the state organized sites or the city organized sites. We have several that have a specific support from the federal government. Because we have so many jurisdictions represented in this call, it's hard to go to each one by one, but just put the search, go to our website and do cdc.gov, how to find a vaccine, and you're going to do that. Or just put in your search engine, vaccines near me, COVID-19 vaccines near me, and it's going to identify those sites. Those of you who have access to the internet can help others, but you're going to see there that we have systems that can be used for those who don't have it. At the same time, because we vaccinated so many people already, we are expanding to primary care. In the next several weeks, you're going to hear that many of the doctors and doctors' offices are getting those vaccines, not just the pharmacy. So we are creating a system that allows for all of us to easily go to a place that have vaccine in hours that works for us, given our jobs. I'm happy to take questions when we come to that. Thank you.
Thank you, Dr. Montero. Finally, I'm pleased to introduce Dr. Robert Harrison. Dr. Harrison will share the importance of the COVID-19 vaccine for keeping all essential workers safe on the job as the pandemic continues. Dr. Harrison.
Thanks, and so good to be with you. I first want to thank Executive Vice President Jones for your leadership and for inviting us here. And all my colleagues at the UFCW, I've worked closely with many of them over the last year, particularly Robin Robbins, who I've known for maybe close to 3 decades by now, Robin. So it's really good to be with you and to meet all the other staff as well. And I've been working for the last year with a number of locals of UFCW around the country, with many other unions of frontline workers. And I just want to say a few things. First, frontline workers like the UFCW members are at higher risk because many work indoors and COVID is spread through the air, mostly in indoor environments. So that is, I think, is a key thing just to keep in mind when I mention the importance of vaccination. There are many layers of protection that I've recommended and my colleagues at the CDC and the FDA have recommended for the last year related to ventilation, keeping a distance, face coverings, testing, keeping track of symptoms. And many of, not all of those, are still remaining in place, although as we're vaccinating, we're starting to change some of those recommendations. So keep an eye and stay tuned. Employers have a responsibility to keep a safe and healthy workplace. In California, we have an OSHA standard for COVID-19. There's a standard under review at the federal level that would put in place a lot of the same protections we have in California. I'm from New York originally, and my mother used to give me chocolate cake. And it was it came from a bakery. Unfortunately, it's out of business. And if it wasn't, I'd be back in New York in a second. It's called Ebinger's. And it's a 6 or 7 layer chocolate cake. I see Dr. Marks is nodding. I don't know if he remembers any of us from New York. And I think of COVID protections like a chocolate cake, actually. And I think of the vaccine like an extra layer on that cake. I think of it like a icing on the cake or something like that. And it's a choice that we each make. So it's up to us, it's up to you, it's up to me as to whether I want to put that extra layer on that cake. And when the vaccine came along in December, I was just absolutely ecstatic, to be honest with you, because while those 6 layers or 7 layers, all those other things I mentioned, looked like they were having some effect, the truth is that the vaccination has had an enormous impact on protecting frontline workers. I had the good fortune of being offered the vaccine because I work at a medical center, and I was in that top tier, if you remember, frontline workers. I wasn't exactly the front line of the front line because I work in a clinic, right? But I was the second line of the front line. And, you know, I'm as skeptical as anyone else. And I looked at the research and I raised my hand and I was vaccinated. But I had staff in my practice who I rely on to keep me going and to come to work. And there were folks who had a lot of questions. And I just said to them, look, I need you to be here for me. I need you to be vaccinated for me, because you're sitting there in front of patients. If you are infected and you're gone, and if you get long-term effects from COVID, what am I going to do? And we just surrounded that person, answered the questions, surrounded her with love. She got the vaccine, and we're now all vaccinated. And now I can tell my patients, look, everyone in my practice is vaccinated. I want you to feel comfortable now coming into my office. And so what are you thinking about the vaccine? So that you can come and I can now see you face to face. And that's the kind of conversations that I'm seeing happen in many workplaces around the country. The final thought I'll share with you is, after I was vaccinated, I came into work and my staff said, Dr. Bob, you look like you lost about 10 pounds. And I said, you know what? I think I lost about 10 pounds of anxiety. You know, I went from the COVID, what do they call it? The COVID weight gain to the COVID weight loss with that vaccine. And I can see my grandson and my family and protect the people around me. So I can't emphasize enough your thinking and getting your questions answered and deciding for yourself, and hopefully deciding to take the vaccine to protect everyone. Thanks.
Thank you, Dr. Harrison. And thank you all. We here at the UFCW are so thankful that our UFCW members have the opportunity to hear from experts like you about the COVID vaccine and what we can do to protect ourselves, our coworkers, and our families. So now I think we'll move to the question and answer discussion, where we get to hear from our UFCW members across the country who submitted so many great questions about the vaccine and how we can all stay safe. So let's get things started with the question submitted by video. This video comes from a UFCW member, Jamie Lee, out of Arizona.
Hi, my name is Jamie Lee. My question today is, as someone who suffered from COVID-19 in July of 2020, is it recommended I take the COVID vaccine when it's available to essential grocery workers, or do I continue to wait as previous media outlets have been discussing? And how long would it be that I would wait? Thank you very much.
Thank you. Dr. Montero, could we ask you to respond to this
Yes.
for Jamie Lee?
Yeah, absolutely. Go for the vaccine. She should get vaccinated now, since people should get the vaccine even if they already had COVID-19. So there is a standard recommendation that you get the vaccine. Now, people should be offered vaccination, right? Regardless of their history of symptomatic or asymptomatic COVID infection. Remember that we know that not everybody has symptoms. Yes, they should, but whatever reason they get tested and they identify, oh, you maybe already had COVID, okay, and they still get the vaccine. You were ill, you had all the symptoms. After you recover, and you have already been told by your clinician or public health that you can discontinue isolation, you should get vaccinated. She mentions in her question that earlier reports said something different. I think that it was Dr. Harrison who said that things do change. And the evolution of the science of COVID-19 has allowed us to know that there are things that we should do and maybe should do differently nowadays. And that's an important piece. The other thing that people gets confused, or the media gets confused sometimes, is that there are some patients that were hospitalized and received some specific type of treatment for COVID-19. In those cases, we recommend them that they wait. But for everybody else, go for the vaccine as soon as you recover from your symptoms and you are deemed that you can get out of isolation. So that's the answer.
Thank you, Dr. Montero. Dr. Marks, the FDA just approved Pfizer for people 12 and over. Can you talk a little bit about what that means to us? And
So great question, and thank you. You're the first person I'm able to talk to about this, so it's outside of FDA, so it's great. So what will happen now is on Wednesday, there will be a meeting of the Advisory Committee on Immunization Practices, and we would expect that they'll discuss the vaccine then, and likely I would anticipate, although they obviously have to discuss it, that they would recommend this for 12 to 15-year-olds, which I think is going to be a wonderful change here for the following reasons. First of all, it will allow us to get junior and senior high school students back to school, which is going to be a big step up. I'm hoping that some of those junior and normal high school, junior high and high school students, that they will drag their parents along to get vaccinated as well, telling them if they're going to get shots, they want them to get shots as well, because this will be a good thing. There's nothing like kids guilting their parents into doing the right thing, and I totally support that. But it will make a difference here, because what we're now doing is broadening the pool of those who can get vaccinated, helping us expand what will get us towards herd immunity. So the more people, we can't vaccinate the smallest children yet safely, but the more older children and adults that we get vaccinated, the sooner we will get to where we need to. And for those who are hesitant to get vaccinated, ask your providers. It's normal to have questions. Make sure you get your questions answered, but I would urge you to seriously consider getting vaccinated, because what we've seen in other countries where the vaccination rates are either not high enough or where they're not lucky enough to have the great vaccines that we have here in the United States is we've seen multiple waves of COVID-19, and we'd like to prevent that here. I mean, it's time to be done with this. And so by getting vaccinated, we can all get there. Don't hesitate to ask the questions. If you're hesitating to get vaccinated because, oh, I'm thinking this is a silly question, there's no silly question. I've heard them all, and none of them are silly. They're ones we just have to answer. Thank you.
Thank you. Dr. Harrison, what can employers do to support workers getting the vaccine?
I would say the first thing is encourage and educate, or maybe those are the two first things, huh? Provide access and assistance. Some employers, particularly large employers, have on-site capabilities. They are able to work with a local county or get their own healthcare provider, their own nurses and medical staff to vaccinate on site. And I've seen that be very successful. Now, I do think it takes a much larger employer with the resources to be able to do that. So if you're working for a smaller employer, I hope employers, and I've seen this around the country actually. So this is where, and I've been part of a lot of labor management disagreements and negotiations. This is one I have to say, Executive Vice President Jones, I've seen more consensus because employers really want to get their businesses to reopen. And I've seen a confluence here, I think, of goals. There can be some side effects that are mentioned, and some people may need to take off a day or two. And so if it's possible for employers to make provisions for that time, if somebody has a severe side effect, some employers have looked at incentives, and I've seen some information that can be effective. I don't really know how much an incentive makes a difference, but the concept that either offering a little bit of time or offering a little bit of financial incentive, will that encourage people? Working collaboratively and jointly with employees and their representatives, so it's transparent. I'm not yet at the point, then speaking for myself personally, of recommending mandatory vaccinations, although there have been some discussion of that in different workplaces around the country, as a major hospital system in Houston that announced that they were going to mandatory.
All right, thank you. And as a follow-up, for our members who have been vaccinated, who still have to work in close proximity to others, should they still get periodically tested for COVID-19?
Is that a question for me?
Yes.
Oh, okay. So I've been working with a number of employers and unions and worker organizations. I am mostly advising that if you're vaccinated, and this has just been updated with the CDC as well a week or so ago, that you don't need to have regular testing unless you are exposed and have symptoms. And so that's also, I would say, an advantage of being vaccinated. If you're not vaccinated, and I'm seeing this in some work sites, so if you're not vaccinated and you're in a high risk setting, then I do recommend testing be done on a regular basis in some work sites where the risk is high or you have the risk of transmission. But if you're vaccinated, and I'd be interested to hear from my colleagues, Dr. Montero, Dr. Marks, generally speaking, I would advise no, not testing.
All right. Dr. Montero, Dr. Marks, would either of you like to address?
I do agree with what Dr. Harrison just said. In our recommendation, actually, when we came out with the recommendation for people who are vaccinated, one of the good things is that you don't need to be tested regularly. In some businesses, they have developed some systems for testing for surveillance, but that's separate. That's a whole different complete situation. So yeah, no, they don't need to be tested. And that's the basic answer.
All right.
And Dr. Montero, the same thing holds true about quarantine. That wasn't a question that was asked, but
Correct.
a lot of questions.
After they get in contact with a
have to
known
quarantine.
case, they don't need to isolate or quarantine at home because we are assuming that the vaccines are good. We know that the vaccines are good. So that's the protection, and that's one of the benefits of being vaccinated. You can continue to go to work. You can resume most of the normality of life that allows you to engage in all of the different social aspects of it.
Thank you. Dr. Marks, does the vaccine prevent a person from spreading COVID-19? Should our members still be concerned about bringing the disease home to unvaccinated family members?
That's a great question, and it's one that we're starting to get answers to. It does not absolutely prevent you from carrying the virus in an asymptomatic state, but it looks from data we're starting to get that these vaccines reduce it by somewhere on the order of about 80%, which is pretty nice. So it does reduce it. If you want to be extra safe, obviously you'll continue, hand washing precautions, etc. Some people continue to wear masks in certain settings, but it probably does do some significant protection. We're getting that from two types of studies. One types of study are studies that are done in the real world. Another, there are some studies now where people's noses have been swabbed routinely to look for this kind of spread. And it looks like roughly, depending on the vaccines, for these mRNA vaccines, it's roughly on the order of 80% reduction. But my colleagues, if they have additional information, should feel free to chime in.
I don't have additional information. I do agree with that answer, but I want to highlight a point. When you go home, your family should be vaccinated as well. We should get all our parents, our husbands, our wives, our kids for whom the vaccine is authorized, vaccinated. This is a common effort of all of us. Let's help get us out of this pandemic together.
I don't have anything to add except maybe a question, which is also related, what's come up to me. What about the variants, Drs. Montero or Marks? Do you worry any more about those and about the question of infection, even though you're vaccinated?
So I could start this one, which is that we're very lucky that the current vaccines, the three emergency use authorized vaccines in the United States, all of them appear to have at least reasonable activity, if not good activity, against the variant that seems to be the most problematic globally right now, which is the South African variant. Goes by the initials B1351, but that seems to be among the worst of these to deal with. And it turns out that these vaccines give you high enough antibody titers that they seem to prevent that in the real world, actually, and not just in the test tube. So hopefully that will continue over time, as we will constantly have to be monitoring for new variants to make sure that none of them escape our current vaccines. We're lucky that so far, even these Indian variants that have come up, at least the first of them, the double mutant variant, seems to be gotten by these vaccines, and we'll know soon about the triple mutant. But again, good news in that these vaccines seem to give us robust antibody titers. Yet another reason we, in some ways, if I sound like a broken record, we are so lucky in the United States to be able to have vaccines that have the degree of efficacy with the type of safety that we have. There's no such thing as a free lunch. You know, every vaccine has the possibility of having some adverse effects, and that's why some of these local effects, the pain in the arm, is something we have to tolerate, perhaps, in order to get the benefit here of not having COVID-19 circulating in our communities. But we are very lucky to have very effective vaccines here. That 95% efficacy. If you would have asked me that a year ago, sitting in this chair, well, I probably would have been sitting in the chair across from this, because I didn't realize that it was better when I was on Zooms to be sitting in this chair and then not having you look at the ugly part of my basement. But that said, last May, if you would have asked me, I would have said if we had a vaccine that was 60 or 70% efficacious, we would have been very lucky. Now we have ones that are, all three of these are 100% effective at keeping people from dying or getting hospitalized from COVID-19. So we're very lucky.
And
Thank you.
so, extra comment on this one, if I may. So one important thing is that the quicker that we all as a society get vaccinated, the less circulation that we have of those variants, so even lower the risk. So the best way to prevent the variants to come around is for us all to get vaccinated soon, before they come. So Dr. Marks told us the vaccine works. Now, let's get that vaccine to work. Let's get vaccinated now, so the strains these variants don't come in here.
Totally agree. Dr. Marks will have to leave in about 4 minutes, so I'm going to pose another question to you, Dr. Marks. Did the clinical trials include people who had pre-existing conditions?
Yeah, indeed, the clinical trials for all these vaccines had about anywhere from 30 to 40% of individuals who had various pre-existing conditions. Oftentimes, they were a combination of things. So sometimes ranging from being excessively overweight to having diabetes or respiratory conditions. So it didn't include people who were truly immunocompromised, like cancer patients necessarily, and that work's going on. But even if you're a cancer patient, you should discuss with your doctor, because I'm a cancer doctor by training, and I would tell all my patients basically that right now they should basically, with rare exception, they should go get vaccinated. You may not be quite as effective, but it's still a good idea. And for others, it looked like these vaccines worked very well in an entire range of people. And I'll say one other thing that you didn't ask me. These vaccines work really well, even in the oldest of the old, which is something that we often don't see with vaccines. So we're very lucky, again, to have these vaccines that are so, and they've also been tested. One other thing, just so people understand, they were tested in a good cross-section of the American population, including the trials had about 10% or more Black, about 20-25% at least Latino, Latinx participants. So good diversity that's consistent with our country.
Dr. Marks, I want to thank you for taking the time to answer these important questions from our members. Thank you.
Our pleasure. And thank you so much for all that you do. Please be safe, keep your family safe, and please consider going out if you haven't been vaccinated and get vaccinated. Thanks so much.
Thank you. Now we're going to continue with our next video question. This question comes from Raymond. Raymond's a UFCW member from Ohio.
So now that we've got the vaccines rolling out at a pretty good rate, why aren't we talking about getting rid of the masks?
Dr. Harrison, would you like to address that, please?
Great question. I really like the intent, I guess, what I want to say. So I guess I'd answer it two ways. First of all, we are talking about it. Dr. Montero might want to comment, but the latest guidance from the CDC, or Public Health Agency, lays out very well, if you're vaccinated and you're outside and you're getting together with someone who is vaccinated or is not, who wears the mask and who doesn't. And so that's changed maybe since the question came in by video. And that's the advantage of the vaccine now that we've gotten it rolled out. It's about 45%, I think, of adults right now, or Americans. Dr. Montero probably has a better number than I do, but it's a lot of Americans. Indoors, it's a different story still. And so we're still recommending face coverings, masks in indoor environments, and that reflects the fact that the virus is primarily spread indoors, and it's through the air, and we're still needing to protect each other from infection while we're going through this period of vaccination and trying to, achieve a big reduction in transmission and infection in the United States. So we still are not saying, okay, just take your mask off. In certain circumstances, if we're eating in a restaurant, obviously those face coverings come off. But if we're gathering indoors with any larger number of people, the masks are still staying on. We heard Dr. Marks also say, while the vaccine is highly effective, it's not perfect. So we haven't achieved that threshold yet. Dr. Montero, do you want to comment any more? Because your agency over at the CDC has put out some really important guidance in the last couple of weeks on this.
So that is a question that we regularly get. And as you have seen, our recommendations have evolved and changed with the pandemic. And as the science evolves, of course, we would love to be able to say, yeah, we are beyond this, you don't need the mask. But there are a couple of things that are real. We have an amazing vaccine. It is really good. It's not perfect, as nothing in life is perfect. So yes, we are going to still see a few cases that may happen in people vaccinated. Masks are really good. It helps us prevent us getting infected or infecting others. As we have been saying, outside, if you are vaccinated, the risk is low. Inside, it's not just for you, but it's for this other that we don't know if they are at a high risk, have a high risk condition that will put them maybe in a hospital or a higher risk of dying if they get COVID-19. So until we get to a threshold, and I cannot give you a number, unfortunately, where we feel confident that most people is vaccinated, then we cannot really get rid of that mask, because it's helping us protect that layer of the population that still has a high risk and that we have not been able to get them to be vaccinated.
Dr. Montero, I'll continue and address this next question to you. Should people who have a pre-existing condition like an autoimmune disease, diabetes, lupus, Alzheimer's, etc., be more concerned about the vaccine? And are there different side effects that they should be aware of? So when we look at the profile of the population, we saw early on that people that were older had a higher level of risk. But when we start to look at this in a more granular way, we saw that underlying medical conditions were kind of one of the risk factors that we identified there for severe illness. Any of the currently authorized COVID-19 vaccines may be administered to most people with underlying medical conditions. They are not expected to have any different side effect at all. It doesn't work different on them. The side effects are going to be the same. I had pain on my arm, especially with the second dose, that lasted 24 hours. That was all that I got. Some people get redness, swelling on the injection site, tiredness, headaches, muscle pain, chills, fever, even nausea. But for most people, those things do not happen. Now, everybody should be vaccinated. If you have some particular concerns, if you're a cancer patient, as somebody mentioned earlier, you should get vaccinated. It's just that maybe you want to talk it with your doctor as well and make sure that you are both in agreement and you know what to look for. Dr. Marks mentioned that with the J&J, the Janssen vaccine, it's recommended for everybody who is 18 years or older, but women on reproductive age may
who have maybe some coagulation issues or platelet issues may want to discuss that with their doctor and make sure that they go over all of the different options that they may have available. But for those other conditions that you mentioned, they should be vaccinated and they don't have an increased risk, and the side effects are exactly the same as in the rest of the population.
Thank you. Dr. Harrison, how long does it take for each vaccine to be fully effective? And what precautions do our members need to take as they're waiting for the vaccine to become effective?
2 to 3 weeks after the last dose. I think Dr. Marks mentioned the difference that the J&J is 1 dose, the Pfizer, Moderna are 2 doses. So there's increasing protection. So there's partial protection after the first dose, and then you get the full protection after the second dose. I say, you know, it's kind of like you're putting on some armor. Don't go out and party, you know, after you've had 1 dose. You get fully immunized and protected a couple of weeks after your second dose. And that's when I think, you know, metaphorically, I lost my 10 pounds. I didn't lose my 10 pounds after the first dose. I lost it after my second dose, right? I was relieved that I didn't have much in the way of side effects after the first dose. In fact, for me, it was a lot easier than the flu vaccine. I'm a baby when it comes to getting my annual flu vaccine, to tell you the truth. This one was a whole lot easier, which surprised me, actually. And so it's 2 weeks after that last dose. And then there was another part to your question, Vice President Jose. I think was how long and
what precautions should they take as they're waiting for the vaccine to
oh,
become
I say same. You're doing the same thing that you were doing before you got that vaccine. So all those same public health precautions. The big difference in my life, I'll just tell you, is that after 2 weeks after I got the vaccine, and my family was also vaccinated, I got together with them, and I waited 2 weeks. And I got together with them, and now the CDC says I don't need to wear a face covering inside, so I can have dinner with them, sitting around the table, without a face covering on because everyone's been vaccinated. And now I'm actually asking. I just met some people outdoors, and I didn't know them, and I just spontaneously said, "Hey, has everybody here been vaccinated?" And everyone said, "Yeah." And I said, "Okay, good. You know, let's go inside. I had to look at a new house. Let's go inside because we were all vaccinated." So I wouldn't have done that until I got the 2 doses.
Right. Thank you. A final question, Dr. Montero, and I know you touched on it, and Dr. Marks, and I believe Dr. Harrison mentioned it as well. But can women who are pregnant or trying to become pregnant get the vaccine?
Yes, yes. Women who are pregnant or trying to become pregnant can get any of the COVID-19 vaccines. We know that the overall risk of severe illness in this age group is low, but pregnant people are at increased risk of severe illness from COVID-19 when you compare with non-pregnant people. So again, the risk is low for this age bracket, but those who are pregnant have a higher severe illness risk than those who are not pregnant. Now, they may be as well at increased risk for adverse pregnancy outcomes, such as preterm birth, when you compare that with pregnant people that has no COVID-19. So now, based on what we know about COVID vaccines and the way that they work, experts believe that it is highly unlikely to pose a risk of people who are pregnant. The data is limited, but it's growing on the safety of COVID-19 vaccines in pregnant people. And in fact, there have been some recent publications talking about that safety and that they are safe. So if you are pregnant or becoming pregnant, or your spouse is in the same process, consider the vaccine and look at that. What's your risk of exposure of COVID-19 and the risk of severe illness? How do you balance that risk? Do you want to take it? The benefits of vaccination are well known, and there is a growing evidence about the safety of the vaccines during pregnancy. So going back to your original question, yes, women who are pregnant or trying to become pregnant can and maybe should get any of the COVID-19 vaccines.
All right, thank you. Now, as we wrap up, I'd like to offer both of you the opportunity, if there's any single thought you'd like to leave our membership with as we move towards closing. Dr. Harrison?
I just want to say that I've investigated many outbreaks in the workplaces in California and some other parts of the country. And I've seen the impact that the vaccine has had on reducing the chances of spread in those workplaces. So I've seen both personally with my patients and with the frontline workers and the unions that I've been helping, that when there's been widespread vaccination uptake, the risk to everybody in that workplace has gone down, which has personally just been so gratifying to see. And so I just want to thank you again for taking these questions and having folks have an opportunity to think about making a decision if you haven't decided to get vaccinated, to make sure you get all your questions answered. If not now, there's a lot of information on the Centers for Disease Control website. I'm going to give Dr. Montero a promo here to read more about it and to make that decision. I think it's up to you, and hopefully we'll all be protecting each other. So thanks.
Thank you, Dr. Harrison. Dr. Montero?
So, Vice President Jones, thank you very much for the invite. As I reflect to what we have talked here today, your membership reflects the populations in the US that were hit the hardest with this pandemic. The pandemic has shown quite clearly for all of us to see out there disparities in health, not just access to healthcare, but everything that is behind. We did investigate many outbreaks in some work sites, in the plants, and all of these risk factors that are out there, the disparities in populations based on that impacted African Americans, people of Latin origin, Native Americans. And many of those things were based on the type of occupation in the front line. Here, we have an amazing opportunity, an amazing tool that is called vaccine. Let's choose to be vaccinated. In the meantime, continue to do the right things to protect yourself and protect those others that we love, that we live with, that we enjoy life with. Keep not getting into crowded cities and crowded places. Wash your hands. Wash your hands. Cover your face. Use the mask. And please choose to be vaccinated. If you choose the 1 dose or the 2 doses, 2 weeks after either one of those, your level of protection is great, and you are doing a lot of things that will get you back to where you wanted to be from your previous life. So thank you for the opportunity. Any questions, ask to your clinician. Go to our website. We have plenty of information in many languages, so you can access those. And thank you again for this amazing opportunity to reach out to your membership.
Thank you. And once again, thank you to our members for joining us this evening. And a very special thank you to our experts for sharing information and helping our UFCW members get the facts they need as we work to make sure that all of our essential workers and their families can access the vaccine and stay safe. We look forward to having an ongoing discussion about this important issue. Thank you and have a good evening.
Thank you.